There are different ways of doing partial turbinoplasties. So I like to highlight you two ways of doing turbinoplasty. One is that when you don't have a powered instrument, you can use simply your turbinate scissors and partially trim the turbinates. And you shouldn't do flush it to the lateral wall and make it more roomy. You have to conserve the mucosa as much as possible so that it doesn't cause any crusting, or in severe cases sometimes it may cause an empty nose syndrome. In this case I just use. So once the turbinate is resected, so you just Swiss roll the mucosa around the bony turbinate that is remaining beneath, and rotate the mucosal flap so that you don't find any raw bone underneath, and give a nice packing with a tight patty so that you gain a good amount of hemostasis. So here this side I use the micro debrider and shave off the mucosa on the inferior aspect of the inferior turbinate, and minimally also on the medial aspect of the inferior turbinate. See to that again you don't go too flush to the lateral wall, which may cause excessive bleeding, particularly at the posterior end of the inferior turbinate. Once the mucosa is debrided, raise the remaining mucosa from the underneath bone as we raise in case of a septal surgery. Once that is done, outfracture the inferior turbinate bone, grasp the bone alone with the turbinate scissor and give a firm cut. Take your time, don't go too lateral, particularly at the posterior end. Using the debrider, the remaining mucosal tags are debrided so that you have a clean cut of the inferior turbinate. Once that is done, the septal elevator is used to give a tight pressure or a compression, particularly at the posterior end of the inferior turbinate, so as to give a good hemostat. And the remaining mucosa is Swiss rolled with the remaining bony turbinates underneath. Suck off the blood, keep the field neat. So feel a little bit of extra tag on the anterior end of the inferior turbinate. I'm just trimming it. This case we also did the concoplasty on the left side and middle meatal anterostomy. See the amount of space that you gain after partial turbinoplasty. Thank you for